Reviewing 10 deadliest diseases in history before the coronavirus. 1. Black Death. Black Death is believed to be the result of an infectious plague caused by the bacteria Yersinia pestis. The disease is transmitted from rat to human by the bite of infected flies. The plague, which caused Black Death, originated in China from the early 1300s and spread westward into the Mediterranean and North Africa. In 1348 it reached southern England, and by 1350 it reached northern Britain and Scandinavia. It is not known how many people died, but it is estimated that 25 million people died of the plague in Europe during the Black Death. 2. Cocolistly. Similar to the disease caused by the Ebola or dengue virus, viral hemorrhagic fever, VHF, is infectious, persistent, and fatal. The outbreak of the VHF occurred between 1545 and 1548 when Mexico swept through the country, making it the most contagious epidemic in the country's history. With a population of 5 million and 15 million killed. This disorder, characterized by high fever and bleeding, is called cocolistly. 3. Cholera epidemics. About 1,500 people died of cholera epidemics in Asia and Europe between 1817 and 1824. The disease originates from Vibrio cholerae bacteria and begins as an intestinal infection. Cholera is caused by eating contaminated food or drinking water. An outbreak of sanitation can quickly turn into a crisis. This can cause severe diarrhea and dehydration and can kill within hours if left untreated. The World Health Organization reports 1.3 million to 4 million cases annually. 4. Smallpox. The origin of the smallpox is unknown. Smallpox is thought to date back to the Egyptian Empire in the 3rd century, before the Common Era, based on a smallpox-like scab found in 3 mummies. The first written account of a disease similar to smallpox appeared in China in the 4th century AD. The earliest written accounts appear in India in the 7th century. During the 20th century, it is estimated that smallpox was responsible for 300 to 500 million deaths. The last naturally occurring case was diagnosed in October 1977. 5. Typhus outbreaks. Throughout history there have been a variety of typhus epidemics, but in 1848 the epidemic killed more than 20,000 people. Importantly, Irish immigrants fled to Canada to escape the Great Irish Famine. Symptoms include fever, red spots on the back of the hands, soreness on the back, chest, numbness, and the smell of rotting flesh. Not long after, during the First World War, the disease spread to the armies of the Eastern Front, killing 150,000 people in Yugoslavia alone. It is estimated that 3 million people died of typhus during the Russian Civil War, with 25 million to 30 million cases reported in 1922, making it the highest in the Soviet region with epidemics. 6. Spanish flu. Spanish influenza or influenza was a deadly byproduct of the H1N1 virus in 1918 to 1920. The Spanish influenza is considered the worst in modern history, killing 50 million to 100 million people in just 18 months. An estimated 500 million people were infected with the virus, and the ongoing war has widened its reach. The disease was also widespread in the final months of World War I. This role is thought to have played a role in ending the 4-year conflict. Unlike other flu viruses that mainly affect the elderly and children, Spanish influenza affects young and uninsured people. Symptoms include colds, tiredness, nausea, sneezing, shortness of breath and coughing. After a bad fever and diarrhea, the patient's lungs fill with fluid and turn the skin blue.
7. AIDS. Human immunodeficiency virus, HIV, causes a spectrum of the condition of the infected, which acquires the immune system syndrome, AIDS. Since 1981, 35 million people have died of AIDS or HIV-related illnesses, including 940,000 in 2017. In 2014, 36.9 million people worldwide were reported to be living with HIV. A report citing the Global Burden of Disease Study 2015, published in the Lancet Journal, found that HIV infections reached the highest level in 1997 with 3.3 million patients. The World Health Organization says the largest HIV epidemic in the world is in South Africa. More than 7 million people are infected. 8. SARS-CoV outbreak. Acute respiratory syndrome, SARS, plagued Asia and Canada from 2002 to 2003. The disease, caused by the highly contagious coronavirus SARS-CoV, spread rapidly to 37 countries globally in a matter of weeks. SARS symptoms include fever, vomiting, and body aches, usually progressing to pneumonia. 9. Swine flu. Nearly 2 million people died of swine flu between 1957 and 1958. The swine flu, caused by the H1N1 influenza virus, hit the first known victim in central Mexico in March 2009. By April, it had reached California, affecting a 10-year-old, and then spreading rapidly throughout the world, causing fear and great panic. These ideas reflected the unusual nature of the virus, which includes birds, pigs, and human influenza viruses. Like other forms of influenza, the disease manifests itself in the form of fever, colds, body aches, coughs, sore throats, runny nose, or red eyes with water. 10. Ebola outbreak. Between 2013 and 2016, more than 11,300 people died of Ebola outbreak in West Africa. The West African Ebola outbreak began in Guinea in December 2013, and has spread to 28,616 people in the West African country of Liberia and Sierra Leone. The epidemic, which ended in June 2016, is the most deadly Ebola outbreak in history, considering the number of deaths.